This is the Power 98.7 podcast. Now we're talking. Subscribe to Power 98.7 podcasts in iTunes or wherever you get your podcasts. There's more on power987.co.za. Tech Tuesday.
Absolutely. It's about 9 minutes after 2 o'clock and we are on air on Power 98.7. And this is some people's favorite conversation to have here on Power Lunch, all about tech. And today we're talking about access to healthcare, which of course remains a critical issue in South Africa, particularly for vulnerable communities that are burdened with poor infrastructure and limited resources. With the majority of the population reliant on public healthcare, there's an urgent need for innovative solutions to improve access and quality. Now, the advancement of healthcare technology, particularly through platforms like Philanthropist AI, or maybe it's .ai, present a very groundbreaking opportunity to bridge these gaps by leveraging data science and AI. Philanthropist.ai offers a personalized approach to health that empowers individuals to take control of their well-being. So that's what we're discussing today, how Philanthropist.ai is playing a transformative role in addressing these challenges, particularly in underserved communities. We're joined by entrepreneur, CEO, and angel investor and philanthropist, Lovkesh Arora. Thank you very much for joining us.
Yeah, good afternoon, Pabi, and good afternoon to the listeners of Power FM as well.
I mean, I should know better. I've learned that with tech names, you mention all the dots, all the hashtags, all of the elements. And this is a very important set of data that you collect and use, and the leveraging of AI as well. So perhaps you can share with us how you define vulnerable communities and what makes healthcare access such a critical issue for these groups.
Yeah. So vulnerable communities are groups of people who are more likely to experience poor health. And certain factors that mainly affect this are your social, economic, environmental, and to certain extent geographical as well. So these groups contribute to the larger part of the access to the healthcare, and especially in the public healthcare sector. And the challenges or the agendas which needs to be addressed specifically for these groups. We define that in three points. First one is your inadequate access, which means how do we make healthcare services accessible to everyone? The second one is limited resources. So that's a challenge, and the agenda becomes as how do we improve efficiency and bring intelligence as well, that we can do more with the limited resources. And the third one comes as inequality in the quality of healthcare. That's an important point to be addressed, is that can we get the same quality of service to the rural areas what we usually get in urban areas over here?
Yes.
So that's how we perceive this, and our entire approach is grounded onto this.
Tell me a little bit about the research or data that you've used to base your understanding of the healthcare disparities in South Africa in vulnerable areas, and how has that then shaped your approach to solving these issues?
Yeah, so this is one of the sector wherein not many researches have happened, but there are few available, and the evidences have also been collected on this. Mm-hmm. And one such paper which is in a public domain, published from one of the recognized university in South Africa. So the name of the paper is Perceived Unmet Needs in Healthcare as Inequality Indicators. Now the paper has evidence on these three challenges that we just discussed, which are inadequate access, limited resources, inequality in the quality of healthcare.
Yeah.
So the paper does talk about, they collected the data, they understood. So now with those evidences, it forms a thinking around those three challenges, that how those to be addressed. And then the agenda of Philanthropist.ai is to promote better health and well-being for everyone and reduce national disease burden and associated cost. Now this agenda is only possible if we solve the three challenges which we just discussed. So that becomes a foundational to our approach in terms of what we're trying to do.
I'm very surprised when you say that not that much research has been done, because this is such a rampant and often spoken about issue in South Africa. What are your thoughts about that?
Yeah, see, research is an expensive affair as well. And specifically in this context of the 80% of the population which access the public health care, and such a diverse settings from a socio-economic, geographical aspect, and covering that from a wider aspect. So it takes a lot of resources. So I'm grateful that some research has happened, and so that itself is good enough and valuable for people like us to be considerate of and think like what can be done to address those challenges.